Good morning, everyone. I'm Erica Shabelli. I'm the Deputy Executive Director here at the Group Insurance Commission, and we're really excited this morning to bring to you a training on the new reduction of waiting period law that is going into effect on July 1st of this year. So this training is specific for municipalities. So if you are not a municipality, you can certainly stick around to see what's going on, but this is only pertinent for those who work at municipalities. Okay, we can go to the next slide. So we'll go through some introductions first, and actually let's just go over to the agenda, if you will, Leslie. I think it's easier to do introductions via the agenda. So I will be taking you through the first three items here: introductions, review of the rule change, and critical items to note about the review. About the rule. Imran from our partners at MTX will be going, I'm sorry, I keep messing that up. Chuck from right here at the GIC will be going through a demonstration of our magic system and items that are changing there. Then Imran from our partners at MTX will take us through a registration demo as well as the portal demo. Chuck will take us through resources again, and then we'll go into Q&A, where you'll hear from myself, Paul Murphy, our Director of Operations, and others on the team as well, including Shane O'Brien, Christina Geary, Maureen Quinn, Andrew Stern, and also Donna Wortman and Alex Everett from MTX. So if you could go to the next slide, please, Leslie. Great. So I mentioned that we'll have a Q&A session. If you look down at I believe the bottom of your screen, you should see a little box that has a question mark in it, and it says Q&A. We'll be using that Q&A function throughout the entire presentation. So you can ask questions in writing there at any time during the presentation. And a member of our team will either answer it live, we'll answer it in writing for you to see once they've completed that answer, or we'll mark it to answer live at the end in the Q&A portion if it's something that's especially pertinent to the entire audience. So again, please use that Q&A function at any time during the presentation today, and we'll either mark it to answer live later, or we'll answer it on the spot in writing. Just keep in mind that we'll only be answering questions today that are related to this reduction of waiting periods. Also, we call it the RWP project here. So we'll only be taking questions that are relative to RWP. If we happen to have time at the end, we can take some other questions, but we're going to focus in on questions relative to RWP since we have a lot of material to go through today, and this is a really important change. We want to keep our focus there. If you have other questions, GIC related questions, please go ahead and contact us using our usual channels of communication, which you can see down the last sentence on this slide, and we'd be happy to work with you to get your questions answered. Next slide, please. Great. So the first thing we're going to do today is go over the rule change itself. So the law that is changing to allow for a reduced waiting period. So next slide. Great. So as many of you know, in the FY24 budget last year around this time, the legislature mandated that the GIC reduce the current 60-day minimum benefits waiting period for all newly hired employees. So you can see an excerpt from the budget language in this sub-bullet here. Essentially what the law is directing is that if an employee starts or their effective date of hire is on the first of the month, then their benefits will be effective on that day. If they are hired any day other than the first of the month, so let's say for July, if they're hired between July 2nd and July 31st, then their benefits will start on the first of the following month. So in that scenario, it would be August 1st. This provision is going to be effective on July 1st of 2024, and we'll talk a little bit more about that in a bit. And just at the outset of this project, just to give you a little bit of background, the GIC worked with our colleagues at Administration and Finance and the IT Division of Administration and Finance to go through a really thorough, exhaustive assessment process to really figure out our path forward here. Given that we had a relatively short period of time to accomplish this project. And so what we discovered is that leveraging our existing systems was really the best way to move forward, the wisest way to move forward, and certainly most cost and time efficient as well. So the purpose of this law is really to reduce or eliminate the gaps in coverage that newly hired employees would experience when they come to the Commonwealth as a new employee. And so reducing the waiting period as we're doing is really accomplishing that goal and eliminating those gaps in coverage for many of the new hires coming into the Commonwealth system. Next slide. Great. So this is just a quick overview of where we are today. So currently Massachusetts sits in this green slice here with 12% of other state employee health plan offerings that have a 60-day minimum waiting period. Once we implement this rule change, we will be in the blue slice with the majority of other state employee health plan offerings across the country. Next slide. Great. So some folks have asked, okay, why aren't we eliminating it altogether? It was, as I mentioned, something that we discovered in the assessment. It was wisest for us to leverage our existing systems. And in leveraging those existing systems, we're going to be taking the average waiting period from 73 days down to 15 days, which represents a reduction of nearly 80%. Which is huge, and we're really excited about that. Again, eliminating gaps in coverage for many new employees. So this table that you see in the white part at the top where it says current, you can see that for the years 2020 to 2023, you can see the percentage of folks who were waiting each kind of category or period of days here from 50 to 90 days. And those are the percentage of new employees who have the amount of days for their benefits to kick in. When you apply the reduced waiting period to those numbers, you see the drastic impact that would have. So again, this is hypothetical. It's the years, if we applied the reduced waiting period to the same numbers from the years 2020 to 2023, you would see a pretty massive impact on the days that folks would be waiting. So we're really excited about this change to see that this will have such a great impact for folks who are working for the Commonwealth as well as our municipalities. And we think that it will provide a level of kind of attraction for folks to be able to apply to the Commonwealth and not have to wait those 60 days minimum. So now that we've talked about the rule itself, what's changing and why, I just want to go through a few things that are really important to note as we kind of embark on implementation here. So something I really want to make sure that folks are aware of and really hammer it home today is that anyone who's hired before July 1st of 2024, so if their effective date of hire is before July 1st of 2024, they will still be subject to the 60-day minimum waiting period, and there will be no exceptions to that rule. This is especially important for this July 1st date. So if you have employees starting on July 1st or around July 1st, please be very mindful of this, that if their effective date of hire is June 30th, which would be that Sunday prior, they will still be subject to that 60-day minimum waiting period, again, without exception. So if you're looking at this calendar down here, let's say their effective date of hire is June 30th, their benefits will not be effective until the 1st of September. So if that person was hired, let's say on July 1st, their benefits would be effective that very same day. Or if they were hired anytime after July 1st, so from the 2nd to the 31st, their benefits would be effective on August 1st. So it's really important that around this time, this late June time period, that we're mindful about hiring and making sure that that effective date of hire is on July 1st or later so that they will be eligible for the reduced waiting period. One thing to note as well, members will still have 21 days to elect their benefits, and we'll talk a little bit more about that. So new hire information should be entered into Magic. Doing so will trigger an email from the GIC system to the member with a registration link for the My GIC Link portal within 48 hours of the new hire start date. And that will allow a member to make their elections quickly. The registration email will be sent to the email address that you get from the employee. And it can be a personal or business email, but we recommend that it is an email that the individual has access to and checks. If you fail to get the appropriate email from the new employee, that can delay the registration email and can also delay access to make those benefit decisions. And again, folks will still have 21 days to make those elections, but it is very important that we give them the opportunity to get those elections made very quickly. And again, we'll talk a little bit more about this later on in the presentation, but want to make sure we're highlighting it here at the outset. One thing to note that the GIC has been working on here with our carriers is that we are increasing our file and data transfers to the carriers so that we can speed up essentially the enrollment and welcome process for new members. Carriers will provide a new welcome email that to date our members haven't gotten. So it'll be a new welcome email quickly after enrollment and that file transfer takes place. And it'll provide members with information about their new plan and kind of giving them some of their benefits information there. Again, these emails will be sent to the email address that coordinators get from new hires. And so again, it's important to make sure that that's an email address that is both accurate and one that the individual checks. And then carriers, because of these increased file transfers, will be able to issue membership cards and other onboarding materials fairly soon after they receive the information. So the whole process will be sped up quite a bit. Next slide. Great. So a few more things that we just want to make sure we highlight, some of which we have already discussed briefly, but again, we want to make sure folks are entering all new hire information into Magic, as that will trigger the My GIC Link registration email to the employee within 48 hours of their effective date of hire. We'd love to encourage exclusive use of the My GIC Link portal rather than paper online forms, and reinforce to collect accurate email addresses. The reason why we want to encourage exclusive use of the portal is because this really speeds up the process and makes it more efficient, both on the GIC side, but also for the member. We want to make sure you share this important information with all the folks in your agency, your municipality, who are part of the hiring and onboarding processes. So we'll be sending this presentation along with the recording out likely next week so that you have access to it for your reference, as well as other folks in your municipality as well. And lastly, the GIC is updating regulations and issuing an administrative bulletin with additional guidance to this end. So the commission at our last meeting on May 16th did vote to approve the regulations, and those regulations will be promulgated for the July 1st effective date. We'll also have an administrative bulletin that will be available before the July 1st effective date with further guidance. Next slide. Great. So that does it for the review and kind of critical items to note. I'm going to turn it over to Chuck O'Brien from the GIC to go through our magic demo. If you have any questions about what I presented so far, please feel free to put it in the Q&A and I'll jump in there now and start to try to answer some questions. And again, please use the Q&A function throughout. And thank you, Chuck. Turning it over to you.
Thank you, Erica. Good morning, everyone. Thank you for joining us. So today we're going to show you some of the features in Magic to assist with the reduced waiting period implementation for new hires. We could go to the next slide. So to start, we'll show you how to enter a new hire into the Magic system. This is a required step for the reduced waiting period implementation. To begin, you'll need to sign into the Magic system. Once in the Magic system, you'll need to navigate to the search page. And on the search page, you'll enter the new hire Social Security number into the insured GIC ID field. Once you have entered the Social Security number, you'll click the search button down the bottom of the page. A message will appear on the screen telling you the ID does not exist and will ask if you would like to add the insured. You'll need to click the Click Here hyperlink to begin adding the new hire record. The Magic page will reload and display blank fields that will need to be completed in order to create the new hire's account. You'll enter the new hire's information like name and date of birth under the insured information section. The insured's home address can be entered under the primary address section. In the contact information section, you'll be required to enter an email address for the new hire in the preferred email field. This email address can be a personal email address or a work email address. The welcome registration email for the MyGIC Link Benefits portal will be sent to the email address that is entered here. In the employment information section, you'll provide the new hire's hire date. The new hire can be entered into Magic 14 days prior to the new hire's hire date or up to 7 days after the new employee's hire date. To complete the creation of the new hire's account, you'll need to review the attestation box and check. Then click the checkbox and then click Submit. Your information will be pre-populated in the coordinator name and coordinator user ID and date fields. Once you click the Submit, the new hire's account will be created in Magic. A reference number is automatically created on the new hire's account. The reference number can be used in the future to find this member's record in Magic. And once on the new hire's account, you'll be able to see all the information you entered when creating the account. The welcome registration email for MyGIC Link Benefits portal will be sent to the preferred email address that is listed on the right-hand side. Once the member has registered for the MyGIC Link Benefits portal, the field portal registered will update to yes. So you can verify once the new hire has signed into our portal. And so this completes the demonstration of how to add the new hire into the Magic system. Now I'm going to turn it over to Imran, who's going to give us a demonstration of the benefits portal.
Good morning, everyone, and happy pre-Friday. I'll quickly share my screen. For this section, we'll take a look at the new hire enrollment process for municipal members, beginning with the registration. Now, before we begin, I want to keep note for everyone that we are using training data. So you'll see names like Peter Parker or some training addresses while we're going through the training. With that in mind, I will go ahead and get started on the registration process. Employees will receive an email for the member portal, and there will receive an important message that you have 21 days from your hire date to enroll for GIC benefits. We can click on the portal link to self-register. We have the email we need to register with, as well as the PIN number to complete a registration on the email. To get started, let's click on the portal link to self-register. In the registration page, I'll go ahead and enter my information. And then I'll also enter my PIN number that I received from my email. We'll just simply create our password and click register to continue. Next, we'll have a verification code that we need to enter. And for that, we'll also receive an email. And we'll need to click copy and paste. So I'll copy the verification code. And I'll paste it on for the verification code here. And then we'll simply click on confirm to log in. Once we log in, we'll be able to see our homepage. And from here, we can go into the portal demo. For the portal demo, we're going to be taking a look at the navigating to resources, as well as the new hire enrollment application. Here, once again, we'll talk about how to navigate to viewing guides, tools, and additional resources on the portal. We'll also navigate to the application by going over two ways, the Go button, as well as the New Hire tile. We'll also take a look at two scenarios for our effective date on the application. On the first scenario, we're also going to cover the documents required before submitting application and the health attestation. Let's take a look at how to navigate the resources. On the home page, we can see that we have our notifications. Here, I have an important notification that says you have until July 21st to submit your new hire enrollment. We also have some important notifications that will come up on this side, so keep on the lookout for that. For our next resource, under the benefit quick links, we have the GIC benefit guides. This is going to help us take a look at resources to be informed to make decisions on our GIC benefits. Let's go ahead and click on this tile, and it'll take us to the GIC benefit guides page. Here we'll be able to see multiple benefit guides for employee types. And then I can click on the view details for each of these. We can click on municipal, state, and we'll be able to view the information and read through that. It'll take us to the mass.gov page, and we can read from there. From here, let's go back to our portal, and then I'll go back to my GIC link homepage. Next, let's take a look at the plan comparison tool. Once again, this is located under the benefit quick links. And here, once I click on it, I'll be able to compare plans side by side. And once I click on the GIC benefit options dropdown, I'll choose health. From here, we can select up to 3 health plans. And then I can click on compare now to compare them side by side. As you can see, we can see the product details for each one of the health plans we selected. If I wanted more information about my copay and deductible, I can click on this link. And then when I scroll back up, we have the option to start over by choosing other plans here. So again, once I click here to start over, it'll take me back to the compare plans page. Let's go back to our home page. And now I'm going to show additional resources that we have. Here we have a few videos, instructional videos that we can go through. And if I wanted to view all of the resources, I can click on View All Resources. And now it'll take me to additional resources that we can look through, starting with videos. And as soon as I scroll down, I can also see user guides for additional information. We will also have a municipal employee user guide as well as tutorial videos for your reference. From here, let's go back to our homepage and we can go to the next section. From here, let's talk about our first scenario. Once again, I'm going to showcase to us how to navigate to our application. But before we do that, keep in mind for this scenario, I was hired on July 1st, so my effective date for my benefits will be auto-populated to the 1st of July. All this means is that when an employee is hired on the 1st of the month, the effective date for that employee will be auto-populated for the 1st of that month. For this first scenario, keep in mind we'll also cover the dependents and how to upload documents for them, as well as the health plan attestations. Let's go back to our homepage. And from here, let's navigate to our application. We have two ways we can do that. We have the Go button under Enroll Today, or under Benefit Quick Links, we have the New Hire information. So once again, I can click on Go, or I can click on this tile, New Hire Information. Let's select Go. And as you can see, we are met with New Hire Information. We can see we have 21 days from our hire date to enroll, our health benefits we're eligible for, as well as important information that we can read through. Let's take a look at what happens when we click on New Hire Information. As you can see, it's the same information. 21 days from our hire date to enroll, the benefits we qualify for, as well as important information for us to read through. And all that means is whenever I want to start my application, I can click on Start Now, and we can start our application. Now that we're taking a look at the application, on the left-hand side, I have my navigation, and in the middle, I have the actual application itself. We have important links that you can click through to get additional information. And once I read my application information to get started, I'll answer yes to the first question and click Next to continue. Same thing for personal information. If everything looks good, I'll go ahead and select yes and click Save and Next. Now we're on the plan selection page. As you can see, we are eligible for the health plans. One thing to note for health plans are going to be determined in your application by the location or your zip code for your personal information. So now that I see my health plans based on my zip code, I can go ahead and select one. If I wanted more details on each of the health plans, I can always click on View Details. Now I'll be able to see important information. I have plan resources for further information, as well as the copay and deductible tab. From here, let's go ahead and hide our details. And when I scroll down, I can see the effective date has been pre-populated for the 1st of July. Once again, in this scenario, I was hired on the 1st of the month. That means my effective date is going to be the 1st of the month. So from here, we'll go ahead and continue to the next question. Now, let's take a look at the dependents or the documents required. Documents are going to be required for dependents before submitting the application. So for that, let's go ahead and add a dependent. I'll select family to this question. And if I wanted further information about the documents required, I can select this link here. Once I click on it, it'll take me to the mass.gov site so I can read about the required documents for GIC coverage. Now that we're back on our application, I'll be able to add a dependent here. I'll go ahead and enter the dependent information. And then I'll click on add to add my dependent. Once everything looks good, I'll go ahead and click save and next to continue. Now that we're on the documents page, I am required to submit a document for this dependent. So if I try to click save and next to continue, I will see this error message that says, please upload dependent documents. Now, if I'm not sure what documents to upload, we have a reference that says document requirements. Here I can see the relationship. I can see the document type based on the relationship, and that will help me identify what to upload. I'll go ahead and click on view and upload, and then click upload files. And because my dependent is my spouse, I'll go ahead and upload a marriage certificate. Once that's been uploaded, I can see the status is marked as green. And this time, when I click save and next, I'll be able to continue to the review and submit page. Now, on the review and submit page, once I've looked through everything, and if I need to update anything, I can do that. But we'll scroll down, and then we'll see the attestation messages. We see there are two attestation messages here. The first one is going to be certifying that I checked that my healthcare provider is in the network. The second attestation is going to be certifying that I understand the plans that I've selected are binding. Once I read through those, I can go ahead and attest to each of the acknowledgements. But before I do, I'd like to show you what would happen if I did not choose the health plan. So I'm going to go back to the plan selection page. And here, I'm going to go ahead and select opt out of health insurance. I'm going to click save and next. We're going to continue till we go to the review and submit page. This time when I scroll down, I can see my health attestation is no longer there. Instead, we see the attestation that is certifying that we understand the plans we selected are binding. Now, because this is a municipal application, I am required to select the health plan. So I'll enter my information. If I try to click submit here, I'll go ahead and enter my information and I'm able to continue. Now, let's take a look at what happens for the second scenario. The second scenario is going to be, if I was hired on July 15th, my effective date for my benefits will be auto-populated for the 1st of August. All this means when a member or an employee is hired on any day except for the 1st of the month, their effective date for their benefits will be populated for the 1st of the following. To take a look at this, we'll go back to our homepage, our portal, and we're going to take a look at this new application. Sorry, not a new application, but the new scenario. Under my notifications, we see that I have until August 5th, 2024 to submit my new hire enrollment for GIC benefits. The reason being is because I was hired on July 15th, I have 21 days, which is August 5th, to submit my new hire enrollment. Let's go ahead and start our application. I'm going to click start now, and we'll be on the application page. I'll select yes to the first question to continue. Same thing for personal information. And then we'll be met on the plan selection page to choose a health plan. Let's select a health plan here. And once I scroll down to see my effective date, you can see the effective date is now August 1st. Once again, when a member is hired, when an employee is hired on any day except for the first of the month, their effective date for their benefits, will be auto-populated on the first of the following month. From here, we're not going to complete this application. Instead, I will go ahead and select save and exit so we can see what happens when I don't complete the application just yet. We can see under my applications, the new high enrollment status is marked as in progress. That means it's not completed yet. And under notes, we can see we still have those 21 days from our hire date to complete our application. And then from there, if I went ahead and needed to complete my application, I'll select continue application here. And that's it. I'm going to hand it back to Chuck now for the next section.
Thank you, Imran. So with the reduced waiting period implementation, there are resources available to assist coordinators within the Magic system. We go to the next slide, please. From the Magic homepage, you can go to the report section by clicking reports in the menu bar. And then once in the report section, you'll need to click the drop down arrow to select the report you would like to view. Today, we're going to show the example of the monthly municipal adjustment roster. So here we can see the monthly municipal adjustment roster listed. And if we select this one, the page will reload. And in the menu bar, you will need to select the as of date that you would like to view and then click View Report. The report will generate below and you can view the detailed information. You can also save and export this report by using the export feature in the toolbar. You'll see members on the adjustment roster who owe a GIC premium or who have overpaid for their GIC premiums. And now finally, within the Magic system, on the right-hand side, we'd like to highlight the Help tab. These guides today, as well as other guides, will be added here in the future. So please visit this Help tab in the future to get these. Additional resources are also available on the GIC's website for coordinators. If you go to mass.gov/GIC, and then once on our website, click the GIC Coordinator Resource tile. In the next page, you'll have to select the My GIC Link Toolkit from the list of options. And then you'll need to select your agency type in the table of contents, which for today is Municipal. There are instructions and sample documents in the top section, and in the bottom section, there are sample videos. Highlighting one of these examples, here we'll show you an example of the registration email a new hire would receive to register for the My GIC Link Benefits portal. And next, we have a sample of the employee acknowledgement form. Coordinators should provide this form to new hires if a new hire does not receive a welcome registration email within 10 days of their hire date. The new hire needs to contact their agency benefits coordinator. And now lastly, if we go back to the GIC coordinator resource section on the mass.gov page, coordinators can click on the section titled New Hire Benefits Law effective July 1st, 2024. Then they'll need to select their agency type again. So for this, again, municipal coordinator section. And then in this section, coordinators will find up-to-date information about the reduced waiting period implementation. Thank you, everyone. That concludes our demonstration of the magic system for the reduced waiting period. I'll hand it back to Erica now.
Thanks, Chuck. Okay. So now we're going to move on to the Q&A portion. Leslie, if you could move to the next slide. Just as a reminder, you can ask questions at any time, even as we've started answering questions in this Q&A session. Please just keep in mind that we are only going to answer questions that are related to this reduced waiting period or RWP project. If we happen to have time, we can get into some other questions, but we're going to try to maintain our focus on RWP. For your other questions, please feel free to reach out to us using our standard channels of communication, which are the last sentence on this slide here. So turning to our questions, we have a couple of kind of lengthy scenarios laid out that have several questions in them. So I'm going to take them in parts. So the first question I'm going to pull out here is anything changing with regard to coverage at the end of an employee's work, I guess, with the Commonwealth or with a municipality? Will they still get that month of insurance coverage after termination? And the answer is yes, but I will turn over to Paul Murphy to see if he has any additions.
Nope, that's correct, Erica.
All
They
right,
cover till the end of the following month. That process doesn't change with RWP.
great. So another part of this question really gets at kind of the billing and deduction process. So the scenario is, if they, when an employee starts, let's say at the end of a month and their coverage is beginning on the first of the following month, they'll basically be a month behind in collecting premiums. And so this question, and there are a few questions kind of related to this throughout, looking for recommendations or guidance as to collection of premiums on the municipal side for those employees. Paul, did you want to speak a little bit to that? And I'm also happy to jump in as well.
Sure. First, I want to say that anyone that elects benefits, they're hired on the first, is effective the first, or any other day they're effective the first of the next month. How it's going to work is no different today on your invoice. You will get your monthly invoice, but there was also an adjustment roster. That adjustment roster is going to now include the people's calculation of what they owe back to their effective date. So you will see more people on your adjustment roster because of the RWP process. Now, since GIC doesn't get involved in premiums by communities or municipalities, it's difficult for us to say what you should do for the employee's paycheck because we don't know what the employee share is by each municipality. We would recommend that you take it from a few salaries, 1, 2, 3 paychecks, or spread it over a period of time. I don't know what your process is for today when you need to do arrears processing, but since it varies, it could depend on what plan the member is electing. It could be an expensive plan. You could put that divided into 2 paychecks, but that will have impacts, I would imagine, on state, federal, and other deductions that take a priority. So it's really up to the municipality on how far they want to spread that premium for the benefit elections. Now, the sooner the member makes the election, the quicker we'll get them enrolled and you can start a deduction. But if members take the full 21 days, it could possibly be 1 or 2 months of deductions that need to come out. But it will be reflected on your monthly invoice on the adjustment roster. So it's really at the discretion of the municipality between them, you and the employee.
Thanks, Paul. Okay, let's see. For the waiting period, for the reduced waiting period, is this applicable to transfers from other agencies?
No, the transfer process isn't changing under RWP. So to give you an example, if I work for the city of Lowell and I leave today, I've already prepaid my deductions for the month of June through the city of Lowell. So I'm paid through June 30th. If I'm hired in another GIC municipality before June 30th, say I hired with the city of Salem, I will be effective in the city of Salem and all my benefits will transfer as of July 1st. So because you prepay for the following month, GIC does not make the transfer effective till the first of the month after the paid through date. So I'm in Lowell, I'm covered through June 30th. I'm hired in Salem June 5th. I am a transfer for GIC benefits as of 7/1 in the city of Salem. There's no new elections, there's no benefits. All the benefits transfer. If by chance I'm in Lowell and I'm covered through June 30th, and I'm hired through the city of Salem, say July 5th. Now my premiums have already been paid for June, but now I'm beyond my paid through date. So you would then apply the RWP rules because the coverage has ended June 30th. So City of Salem, the RWP rule applies. If I'm hired on July 5th, it's August 1st. If I'm hired on July 1st, it's July 1st. So there's really no change to it. It's only if they're paid through and after the coverage ends and they're hired in another municipality, the RWP will take place.
Thank you, Paul. Similarly, will this also shorten the enrollment time for new retirees?
It doesn't shorten the enrollment time for new retirees. That process isn't changing. When someone leaves the municipality and they retire, we will transition them into a retirement status and they'll appear on your invoice as retired, but nothing shortens that time. Now, if you're referring to a retiree who wants to enroll as a qualifying event as a retiree, never had coverage, they can do so, but that process is the same today, so nothing's changing with that.
Thanks, Paul. This is related to Magic. So what if the hire date changes after the coordinator has already entered it into Magic? What can they do?
If you've already submitted the new hire record, you will have to contact your auditor in the GIC's audit unit to have that change done. Once it's submitted, you can't edit the coverage or the data for that member. So you have to contact the audit unit to adjust that date.
Thank you. If a new employee does not receive the registration or invitation email to the portal, how can the coordinator ensure that it's resent? Because they often are getting folks who can't find it, or they maybe deleted it, went to a spam folder, etc.
Well, there's a couple of situations here. If the original email registration went to a spam or junk folder, when the member goes to the registration page on the portal and they enter the personal information in there, they can do a resend pin. When they do a resend pin, they'll get the information sent to them. However, some people, it is blocked. So if members use a work address, sometimes that resend pin is blocked at the municipality level through the IT department, and they won't get that resend pin. There's also going to be situations that if someone didn't get it, I would recommend that you go into the Magic system, you view that member's record. If it says no for registration on the portal, which it should, check the email address that is in the preferred field in Magic. If that email address is typed incorrectly or needs to be updated, you can update the email address in Magic. Once you put in a new email address, a brand new registration email will go to the member the following day. If all else fails and there is no new registration go or resend pin, I would recommend you go to the Magic homepage and go to online forms and start the process there to send the member the enrollment forms. That would be the way to avoid the 21-day deadline being missed.
Thanks, Paul. Can a coordinator select the benefit start date? For example, The new hire date is the 1st of July, but they have coverage from their previous employer until the end of July. Can we update the health insurance to start August 1? The answer there is no. The member must make those elections within 21 days. And the law is pretty clear here that if their benefits, if they start on the 1st of the month, then their benefits must also be effective on that day. However, if you hire them July 2nd, and that's their effective date, then their benefits would be effective on that 8/1. So there is a little bit of leeway here in terms of how you are doing your hiring, but with regard to when the effective date of hire is that the GIC receives, if you start on the 1st, your benefits are effective the 1st. So no, a coordinator cannot select a benefit start date. Paul, anything to add to that?
The only thing I would add, Erica, is that if somebody declines the benefit when they're hired because they happen to be covered somewhere else, the qualifying event rules still apply as they do today. Members can come in with the qualifying event or the next annual enrollment. So, the qualifying event is still an option if they decline benefits because they're covered elsewhere.
Great. So while we're on the topic of declining benefits, we actually have a couple of questions related to that. Does the new employee need to go in and decline if they're not enrolling in health insurance? Or, do they have to do anything to be able to decline it, or can they just kind of let it sit?
Well, we would recommend that you enter the new hire information in Magic. Therefore, a registration email will go out to the member. The member can then go to the portal, register, and go in. When they start their election, it says to enroll. The first question is going to be, do you wish to enroll in GIC benefits? They can hit yes, or they could hit no. When they hit no, that's all they need to do. The portal will not walk them through anything else. The good thing here is that if by chance the member wants to come in with the qualifying event or the next annual enrollment, the record in the portal already exists, and the member can go into the portal and use the portal even though they decline benefits. One thing worth noting here is that any member that declines benefits in the portal, on the Magic homepage, you will see up in the blue taskbar a declined benefit tab, where you will be able to see your members that have declined benefits. So we would recommend that you put it in Magic, let the member go in, let them decline, so if they need it in the future, they can use the portal. And then there's also a record under the Magic tab, under Decline Portal, the homepage. You can see everyone that has declined benefits if there's any question coming up in the future.
Thanks, Paul. So we actually had a related question, so I just wanted to, and you kind of answered it there, but just to reiterate, if an employee declines now in the portal, how can the coordinator go out, be able to print out such verification if it's needed for an audit or something like that?
Other than the Magic homepage where they decline the benefit and it shows that they have declined the benefit, there's no printout in the portal for a coordinator, nor is there a printout for the member because the member didn't get to go through the portal and go through the application process. So I would recommend that either the Magic decline benefit tab can be used and the agency can give a letter to the member saying that they have declined the benefits, or use the Magic system. If there's no benefit selected and there's no termination in the system, you can also give the member a letter that they declined benefits.
Thanks, Paul. Along those lines, so let's say that a coordinator enters an employee into Magic and they don't elect their benefits, but they have a qualifying event that comes up. Would the coordinator then need to do paper enrollment if they don't have the registration email? And this isn't exactly pertinent to RWP, but it is related to the kind of registration email portion. So would they need to do a paper enrollment in that situation?
If the member can't find their original registration after it was entered in Magic and went out and they have a qualifying event, you can do the paper enrollment. Now, in the Magic system, on the Magic, on the GIC website, you can do the print form option and mail the forms into GIC. That takes a little longer for processing. But you can also go to, if there's no record in Magic, the Magic homepage, just click on online forms, enter the employee's information, and electronic forms will be sent to the employee from the Magic homepage.
Thanks, Paul. So we have a couple of questions related to kind of transfers as it pertains to RWP. So I'm going to take some of those questions here. Can a new hire enroll in benefits at my school or municipality if they already have GIC benefits with another municipality?
The simple answer is no, but it really depends on the dates and the transfer. So if I go back to my original example, I work for the city of Lowell. I have Unicare Plus. I leave the city of Lowell today. I have Unicare Plus. I'm covered with the city of Lowell through June 30th because I've prepaid my insurance premiums. If I am rehired in any municipality that exists with GIC prior to June 30th, then I am considered a transfer. And therefore my Unicare Plus plan will transfer to the new municipality effective July 1st. So there's no reduced waiting period here. The current benefits just transfer when the member transfers to the new agency. If I work for the city of Lowell, I've already paid my premiums through June 30th. And then I'm hired with the city of Salem after my payment date, June 30th. Say I'm hired July 15th. Then I am a brand new employee. So one, I can elect new benefits. And two, the reduced waiting period rules now apply. The person would be effective with GIC benefits August 1st, and they can elect a new health plan. So it's really timing on when the coverage ends, what they've prepaid, and the date they're hired in the new municipality. In some cases, they're not new, coverage transfers. If the coverage has already ended and they're hired in a municipality after that payment date, then they have to elect benefits as a new hire and the rules apply.
Thanks, Paul. So in that situation, let's say if someone is experiencing a gap in coverage when they're transferring, would they need to pick up COBRA for that month, or is that not a requirement?
If somebody leaves one municipality and say they're covered through June 30th, that municipality terminates them because they don't know what's going to happen. They don't know if they're a transfer, or the employee doesn't even know if they have another job. If the municipality terminates them as a leave state service, COBRA rights will go out to that employee automatically when the municipality terminates them. If they are hired in a new municipality, it's really going to depend on the date of hire. So use my example. If I work in Lowell, I leave, I'm covered to June 30th. I will get COBRA information if Lowell sends in a termination to GIC. If I'm hired in a new municipality in July or August, if I'm hired in July, I'm going to be effective August 1st. I will have a gap in coverage. So it's up to the employee if they want to take the COBRA for the month of July. So it's really at the employee's discretion at that point. They won't have a large gap like they do today when they leave and they have a new waiting period, but it's really up to the employee.
Thanks, Paul. Staying on this topic of transfers, will the transfer date be reflected in the GIC portal? As of now, the municipality needs to contact the GIC rep to understand the transfer date.
It will be in the portal. The thing to remember is because premiums are prepaid by the prior municipality, GIC's effective date for the new municipality is later. So I keep going back to my Lowell example. I'm covered to June 30th. I'm in the new municipality as of July 1st. That information doesn't get changed in our system until July 1st. That's why they see their prior information. But it will update eventually to the new municipality, and it will show in the portal as well in Magic when they transfer.
Thank you. Does coverage still end on the last day of the month following the month in which the employment is terminated? The answer to
Yes.
that question is yes.
Yes.
That is not changing. Let's see. Have a couple of questions about forms that new employees should sign and where we can find, where coordinators can find those new forms.
Well, there's two options. One, if you want to use the DocuSign electronic forms, you can initiate it from the employee's record in Magic. So if the employee exists in your municipality has a record in Magic, from the members page, you can initiate online forms, and that will be sent to the employee from that employee's record in Magic. Those forms will also be populated with the employee's information. So if the member exists in Magic and you pull that record up in Magic, click on online forms, and you can send forms to the employee, and they will be populated with name, address, agency, because you're in the record. If you want to send electronic forms to somebody who doesn't exist in Magic, go to the home page, click on online forms, enter the information, and then whatever you enter there, that information will go to the employee electronically. They will get the documents, they can fill them out electronically, and they can submit them back to you as the coordinator electronically. If nobody wants to use the online form, or you don't want to go to the Magic record, there's always the print option. You go to our website and you type in print forms, and from there you select the forms you need under Municipality tab.
Thank you. Another question about declinations. What if a new hire ignores the portal and they don't decline online? How will the coordinator know that they have declined?
They won't. I mean, it's totally between you and the employee. They won't know that they declined. If they didn't enroll, now you will get reminder emails as a new employee elects benefits. There are reminders coming out of the portal saying that you have 14 days, you have 7 days left to do your enrollment. You will also get a copy of those emails that go to the employee. So there is a reminder email on day 14 and day 7 that they haven't elected benefits. If you can use that email to follow up with the employee. But if the member does nothing in over the 21 days, there's nothing in the system that's going to be able to tell you they didn't elect it.
Thanks, Paul. A clarifying question about deductions and premiums. So we have a question here. If an employee starts on August 28th and they leave September 4th, will they need to collect 2 months of premiums from a small paycheck, as they should be covered from 9/1 to October 31st? Is that correct? And if they don't have any paychecks with them, can they terminate for non-collection if they don't pay us?
So I'll take that in two parts. If the person is hired August 28th and they leave on September 4th, under our rules today, they're covered till October 31st. So you would have to collect the premiums for September and October from either that small paycheck or bill the employee. If you can't collect those premiums from the employee, or that you get no response from the employee, you can notify GIC using the termination form, the Form 1A, and we can enter a non-pay under that employee's record and void the coverage.
Thank you, Paul. A question coming up about the portal. Is it now required that all employees have to register through the portal, or can we still have paper? So I can take this one, Paul, and give you a little bit of a break. It is not required that all employees have to register through the portal, but it is strongly encouraged at the GIC. And Leslie has just put up a slide talking about access to the portal. So please take a look at this while we're answering some more questions. You still have access to paper and online forms, but we strongly encourage exclusive use of the portal for lots of reasons. One, It makes the process more efficient and far faster than the paper and online forms. And it really is a great way to get the member kind of involved in their own process and have access to their information 24/7. Anything you'd like to add there, Paul?
A couple of things. It will speed up the enrollment with their health plan, if they use the portal, because now we're changing the frequency of our files to the health plans from once a week to twice a week. So the quicker they elect benefits in the portal, the health plan will be notified. And we're also going to institute sending out welcome emails for all the health plans. So the member will get a confirmation email that they have been enrolled. So that helps. It speeds up the process if they use the portal. I think as far as if they use the portal, one thing to keep in mind is no enrollment forms. Once they submit their documents, it automatically goes into our magic system. So by doing that, you will then see it on your weekly change report quicker so that you can initiate deductions, whereas the paper has to get mailed, sent, reviewed, processed, and entered by GIC, which will delay, putting them on that weekly premium change report. But by using the portal, there's no forms. It goes into Magic directly once they submit. And then the following Monday, you get it on your weekly change report. So that will also help cut down on these retroactive premiums that need to be collected.
Thanks, Paul. So before I ask this next question, which I think is going to be a reiteration of what you've just said, I want to encourage folks, we still have time for questions. So if you have any questions, please go ahead and put them in the Q&A function. And we are happy to continue answering questions since we still have a little bit of time left here. So again, Paul, just reiterating what you've just talked about there is how quickly will the portal, I guess, and therefore Magic, be updated once the employee elects their coverage?
Once they hit submit, it's automatically in the portal and it comes to GIC and loads into Magic. So the health plan elections will go directly into Magic. The only part that may slow down a little, and we still have to review it, is if the member has a family plan, we have to review the birth and marriage certificates. So the family may not go in until we review it and approve those documents, but the coverage election, whether it be, plus individual, plus family, etc., once they hit submit, it goes directly right into Magic. And it's in the portal.
Great, thank you, Paul. Wow, I was just about to say we don't have additional questions, and then several have popped up. Okay. Is there any different process going forward with the legal review for qualifying life events? My quick answer to this question is no, that nothing is changing regarding to qualifying life events, but wanted to kick it over to you, Paul, if you had anything to add.
No, nothing's changing with the qualifying life events. I will say that we update that and we review that every year. So it was just updated for annual enrollment. So if you want, go out to our website, look at the qualifying event chart, and you will have the most up-to-date qualifying event chart. It's now out there, or it has been out there.
Thank you. So I see Donna is answering this question as we speak, but just to reiterate, when does the insurance plan receive the member information? And so as Paul noted, we are transferring that information to them weekly at this point. Paul, did you want to elaborate on that?
Yeah, the current process is it goes to the health plans every Monday. So we're changing that process to Monday and Thursdays, starting in July.
Great. Can we share the GIC audit contact for purposes of changing hiring dates? We can certainly do that. I can try to put that in the chat, or we could share that.
I think, Erica, I think that's going to be a problem because we don't have a list of the audit contacts available. I believe that
see.
what the person is referring to is the actual audit unit. The calling in the phone number 727-2310, there is an option to speak to someone in our enrollment and eligibility unit, which goes directly to the audit, but we don't have a list that we post for contacts for the audit unit, because we have 1,200 entities, and those entities are divided between the audit unit. So a set of entities are required to be answered by a particular auditor. So some auditors may have 300 agencies, some may have 200 agencies, depending on the size. So I would just recommend that you call the audit unit and they can help you, because they're all in the same unit to give you the information you need.
So Leslie, if you could jump back to the last slide. I think we have our contact number down at the bottom there. And that's the number that you can give us a call at. And Paul, you said the
I think it's option 2 or 3.
okay,
Sorry,
and
but
you said it's eligibility would be the
enrollment
menu
and
option.
eligibility. Yep.
Enrollment and eligibility. Okay.
Been a while
So
since I called my staff. Again, it's just, there's only 4 options in there. One is public information for benefits. I think the second one is maybe retirement. The third option is audit, and the fourth one is life insurance. So
great. Thank you, Paul. Let's see here. Just going through. So we have a non-RWP question. When a retiree passes away, what form needs to be completed to notify the GIC?
the enrollment and change form 1A, you fill it out under the termination section. You check off termination, you write deceased, and you give us the date of death.
Great. So let's see here. Looks like we don't have any open questions at the moment. So Leslie, if you could go back to the My GIC link slide, just to leave that up here for a moment. Okay, one more question. Does the form 1A Muni also apply to retirees for the death of a retiree?
Yes.
Great. Okay. So seeing no more questions here, and you know, if some pop up while we're wrapping up here, we can certainly take them. As I mentioned at the outset, we will be sending this presentation and recording out along with some frequently asked questions. So we'll actually be using this Q&A report from this webinar to populate some frequently asked questions that we can send out along with the recording and the presentation. So please keep an eye out on your inboxes for that. And feel free to share with folks involved in the hiring and onboarding processes across your municipality. Let's see here. We do have one more question. Don't we use the RS form for all retirees?
Yes, the RS form is for enrollment and changes regarding health insurance or cancellations. The Form 1A is the one you use for the death of a retiree, but the RS is still there for your retirees and survivors.
Great. Thank you, Paul. All right, seeing no further questions, I think we can wrap this up. If you do have questions that pop up between now and the go live date, please feel free to reach out to us. We'd be happy to take any questions, and we can certainly, if appropriate, include any follow-up questions in the frequently asked questions document that we'll be pulling together for everyone. So thank you all very much. And we hope you have a fantastic long weekend. And again, reach out to us if you have any questions. Thanks very much, everyone.